Yeah, so today we're going to talk about what is infertility, and we're going to discuss a few of sort of the basic Chinese medicine principles for treating infertility. And then we want to introduce to you two of our DAO Labs formulas that we think are really useful, and I'll try to give you some guidelines on how to use them in supporting your patients and trying to help them with their infertility issues. So let's go into the next slide. Oops.
Did I cut it too many times?
Yep. There. What is infertility? Yeah. So just for a few basics, one, we want to recognize that infertility is a really complicated condition, and it's got some well-known causes such as endometriosis, polycystic ovarian syndrome, and other causes. But there's also many times where patients will come to you and they really don't have a good explanation for what's going on. And then it's kind of on you as a practitioner to come up with some solutions. In either case, you'll be trying to kind of find some solutions for your patients. One basic definition that we usually go by is when a couple is unable to conceive after 12 months. We usually define that as infertility. Now, how do you go about treating it? There's really sort of two basic approaches we could talk about here. One is sort of in biomedicine, and you're probably familiar with some of these approaches, but in general, what we're talking about is often hormonal therapy, first to kind of manipulate ovulation to essentially force a woman to ovulate, and that can be done with something like Clomid or other drugs. And then if that doesn't work, then usually you sort of step up to more advanced techniques to then facilitate conception and implantation, and you're getting into things like in vitro fertilization, and those are often very expensive approaches. But the bottom line in biomedicine is that in some sense we're doctors are sort of using drugs. This is, of course, in the case of female infertility, to sort of take over a woman's body and try to take over that menstrual cycle and see if they can kind of control it with the drugs. The approach in Chinese medicine is radically different. And here we're really working with a woman's body. We're trying to to correct the imbalances and the patterns of disharmony that we see sort of affecting fertility. And through that approach, we try to maximize and improve the woman's chances for conception. Let's go on to the next slide. And so there's a great word in Chinese, TAO. That's the character that you're seeing on your screen now. And this really kind of gets at probably like the first principle of gynecology, and therefore of fertility treatments in Chinese medicine, which is to tiao yue jing, to regulate, to modulate, to adjust, to harmonize the menstrual cycle. And this word kind of tiao means all of these things. It's something you want to. It's even means sort of tinker, to slowly alter, change, improve. So this idea of tiao yue jing is sort of our key idea, tiao jing. And when you can regulate the menstrual cycle, when you could sort of get it to be as regular and as consistent as possible, that's when you've also got the best chances of conception for your patients. Let's go to the next slide and just do like a quick little review of sort of the biomedicine understanding of the menstrual cycle. And not that we want to get too deep into this, but I think it can be a little bit helpful here for some things I want to talk about down the line. But you'll notice that the diagram on the right is that we can kind of think of the menstrual cycle as happening in a couple of different stages, and sort of at a minimum, you might think of sort of the follicular stage and the luteal stage. The follicular stage is sort of like beginning right when menstruation begins, and first the lining sloughs off, but then your and then you're slowly rebuilding as sort of the ovary is preparing the follicle, which will then kind of eject the egg. And so then around 14 days in the ideal cycle, you have ovulation. Then that follicle becomes the corpus luteum. And if there was conception at the time, the corpus luteum would be playing a very important hormonal role to maintain the pregnancy, producing progesterone. But if pregnancy doesn't happen in this second stage, the luteal phase, then you'll see sort of a drop in progesterone. And when it hits to a certain level, that's when you have the menstrual cycle. So one thing to kind of note here is at the end of these two moments, the follicular phase and the luteal phase, you have this like shift and kind of, you have these hormonal shifts that are happening around ovulation and the end of the cycle. So we'll come back to that a little bit later in the talk, but that's a useful thing for us to remember. Now let's shift to sort of Chinese medicine principles, and I'm going to read you this quote that I really love from Chen Shouyuan, who's a Qing Dynasty doctor from China who wrote a very interesting book, The Essentials of Women's Medicine. So he's got a quote, and the important part about this quote is the role of blood here. So I'm just going to read the quote because I think it's such a great quote. This is my translation. So when blood is flourishing, the menses is naturally regulated and pregnancy is easily achieved. That's our first point, actually. When yin and blood are ample, no disease can arise. When yin and blood are deficient, numerous illnesses will occur. Moreover, a woman's blood is consumed during menstruation and exhausted by childbirth. With the diseases of leukorrhea and uterine bleeding, there is great loss. Therefore, treatment for women should focus on yin and blood. And so some of you may have heard the expression that blood is the foundation of woman or the root of woman. And this is sort of what this quote is getting at. Yin and blood, or here we might even just summarize as blood, is precisely what the woman loses during menstruation. And it's also what is sort of like needed and necessary for conception and to happen. So if it's flourishing, as he says, pregnancy is easily achieved. And it's when it's not flourishing, that's when we have to kind of get involved and find our strategies for modulating the menstrual cycle. So this takes us maybe to our next slide, which is one of the most famous prescriptions for dealing with blood and dealing with a woman's menstrual cycle is the forced substance decoction. We call it women's formula here, but it's Dangui, Shou Di Huang, or Shu Di Huang, Bai Xiao, and Chuan Xiong. These four herbs together are a great blood supplementing formula. It's known as Su Tang in Chinese. And this is like, this for many doctors in China will say, like, if you know how to use this formula, like, you know how to be a gynecologist. This is a formula that's extremely important in Chinese medicine gynecology. Now you may not use it in its, you may start with this formula and you may add to it, or you may supplement with other things. But often, like, these four herbs are going to be essential to sort of many treatments that you have in gynecology, and really important for dealing with infertility. Let's go to the next slide. And so, as Chen Shouyuan told us, we have this women will have this tendency to be towards blood deficiency just by the nature of their menstrual cycle. Every month is a little bit of bleeding. If that bleeding happens to be a little bit heavier for some women, you can actually become anemic. But even if you don't become anemic, that doesn't mean you're not also don't have a blood deficiency, as sort of we define it in Chinese medicine. So this is sort of a great formula for in Dow Labs. We've tried to make it a little bit more of a pleasurable experience. We've used raspberry and black pepper to kind of flavor it, and this can be something that's a really important part of infertility treatments and just regulating the menstrual cycle in general. Let's go to the next slide. So if we're talking about menstrual regulation, this is a formula that you can often used once a month. We recommend kind of doing it at the beginning of your cycle to kind of get you off to a good start. But it can kind of help you to feel a little bit more energy, help you to sort of bounce back from sometimes the struggles that women have during menstruation. It's also can be helpful with cramping or both sometimes heavy bleeding and kind of light bleeding, kind of depending on the reasons. So it's a great formula for really helping to regulate the menstrual cycle. Let's go to the next slide. And this is the other formula that we really want to make you aware of, and that's also used very commonly in infertility treatments. And this is Free and Easy Wanderer. We call it emotional balance at Dow Labs. It's also known as XIAO in Chinese. It's got a little bit more complicated makeup. It's got Dang Gui Chai Hu, Bai Xiao Fu Ling Bai Zhu, Pao Zhang, or really that's probably Wei Zhang, like the baked ginger. Boha is mint, and a little bit of licorice, Jigan Cao. So this formula is named after a famous chapter in Zhuangzi's Taoist text. In Chinese, it means basically sort of meandering, wandering. That's how you often hear this name, Free and Easy Wanderer, or sometimes it's called rambling powder. And that's often how this people feel when they take this. They feel sort of like they've let your hair down a little bit. You've helps. It's great with stress. We say that this formula treats liver qi constraint, but it does so also by dealing with spleen qi deficiency and a little bit of liver blood deficiency. So it's this interesting relationship between the liver and the spleen here, and between qi and blood as well. But this formula is a formula that maybe first and foremost deals with qi constraint, and also getting at some of the roots of why we don't have the free flow of qi. As we all learn in kind of our Chinese medicine courses, qi is the commander of blood, and blood is the mother of qi. So this is a formula that can be really paired well with the four-substance decoction, or Su Wu Tang. Su Wu Tang is supplementing blood. This formula is maybe the formula you need to move qi, and by supplementing blood and moving qi, I think we can. This combination is one that can help us to get at some infertility issues. So let's look at the next slide. So Free and Easy Wanderer, just on its own, is a great formula for women's gynecological issues. It's for women who are dealing with premenstrual syndrome. This is a great formula. Breast tenderness, headaches, emotional volatility. This is a great formula to use maybe a week before a woman starts her cycle, starts bleeding. This is a great formula. It's also just wonderful for kind of dealing with stress and irritability, digestion, headaches, especially if you have digestive issues that are related to stress and emotional issues. So many uses for this formula, and you may all be familiar with that. But I wanted to also mention that it's also a formula that's great for promoting ovulation. And this is where I think we can kind of see how the combination of the formulas can really be helpful. If you remember back to our chart of the kind of the cycle of the hormonal cycles and the stages of the menstrual cycle, we saw those two shifts, hormonal shifts, right at ovulation and right at the end of the cycle. This XIAO is a formula that can get at facilitate those two shifts, right? If we don't have the free flow of qi at those moments in our cycle, it's likely that we won't have a smooth ovulation, or we won't have a good transition at the end of our cycle. We'll be struggling with PMS. So if we use the two formulas together, we can start with Tang or woman's formula, dealing with a blood deficiency and restoring the blood at the beginning of the cycle, then move to emotional balance to facilitate the free flow of qi. You have a pretty potent combination here of two formulas that can both get at two levels of like the menstrual cycle, both the sort of the qi and the blood level. And this is something that can be really useful for some women who are struggling with fertility, and there's a lot of women out there who don't have, a clear diagnosis, don't have a clear answer for why they have fertility issues, and so this is a great place to start. And it's not going to be the answer for every problem, but because, as we said, infertility is a complicated problem. But just this alone is maybe enough to kind of get things back on track for a lot of your patients. Now, as we note here on the slide, you definitely want to work with your partner here. Timing can be a big issue in getting pregnant. So I definitely recommend to my patients, use an ovulation predictor kit or track your basal body temperature, follow your cervical fluid. You really want to, as much as possible, borrow a little bit here from biomedicine and try to figure out exactly when you're ovulating in your cycle so that you can be timing things with your partner. We want to recognize that sperm has a limited lifespan in the body, maximum 5 days, but probably 3 is maybe more accurate in most cases. And then if we can also sort of get patients using something like Dow Labs Women's Monthly Kit to help maximize and sort of optimize their cycle, then you start seeing chances of conception going up. We recommend you want to do this for probably several cycles in a row. The way we usually say to use it is start with women's formula. So once your cycle is done, usually wait a day or so to make sure it's completely done. And then for the next 4 or 5 days, take women's formula. I recommend doing it twice a day. And this is going to really be helping you kind of prepare for the rest of the cycle, building up that uterine lining. Depending on how long your period lasts, you might be starting as early as sort of like the 4th day of your cycle. We usually measure from the first day of bleeding. So you might be as early as day 4. It might be more like day 8 for those of you who have like a longer cycle. When you're done with women's formula, again, depending on how long your period lasts, but somewhere roughly around day 10, 11, 12, again, depending where you are figuring out when ovulation is happening, start taking Tao emotional balance. So you can take it for the next kind of 4 or 5 days. Again, taking it twice a day. And this is really going to help you with that little hormonal shift that has to happen to make ovulation happen. And so if you have good timing here as well, then together with all your other methods for tracking ovulation and working with your partner, I think you're really going to optimize your chances for conception. And again, may not work that first month, but give yourself a couple of months to really sort of regulate that cycle, and hopefully you're going to see these. Hopefully, you're going to see the results. So we've got a few questions that people tend to ask us about these formulas. Are they safe? And yes, I think in general they are quite safe. And so they're a good fit for a lot of patients. It may not be perfect for every patient. So if you do notice patients having some kind of side effects from these formulas, then they're probably not a good fit. I'll give you one quick example. Just recently, I had a patient use the women's kit, and when she took XIAO or the emotional balance, she noticed she was getting some slight headaches from it, which was interesting. Typically, you might think of this as being something good for headaches, actually, the sort of headaches you might have at the end of your cycle. But she felt like it actually caused her some headaches, and so it ended up being not a good fit for her, and we actually shifted to some other herbal combinations. So yeah, tune into those kinds of responses. I don't think side effects will be any more major than that sort of thing. But generally, if it's a good fit for the women, they should just be feeling good and better and better. Can you continue taking the formula while you're pregnant? You can, but I don't think you need to in general. And that's a situation where you probably want to work with your practitioner and see what's going on. If you have a history of miscarriage, if you've got some other concerns while you're pregnant, that's where you want to maybe get some more specialized advice from your practitioner. So in general, I don't have patients taking herbs while they're pregnant, unless there's kind of a good reason to. And Chinese herbs are wonderful for dealing with all kinds of issues that come up during pregnancy. But again, I think work with your practitioner in those situations. What's the success rate? That's that one I can't answer, but I think it's often it's often good if this is sort of, if we're looking at problems of sort of in qi and blood, and then this is going to be a pretty powerful combination for you. How soon should you start seeing results? Well, I always tell patients that you should see results. So you don't want to feel worse. You want to feel better. You want to notice some things going on, and somehow, and just kind of also you need to kind of recognize your own situation. How complicated are the problems? You want to give yourself some time as well. And one of the struggles in gynecology is that often the main thing you're tracking is the menstrual cycle itself, and so you have to kind of, there may not be a whole lot of symptoms going on until like the period itself comes, and then you notice that there's less cramping, there is less bleeding, or the blood flow is better, or less clots, or things like that. And so sometimes those will be your main ways of sort of tracking what's going on. If you weren't menstruating and now you're menstruating on a more regular basis, again, you're kind of have to wait 30 days and then another cycle to see how that's going. So hopefully you should notice some benefits. And then if you do, I think you want to stick with it until you really feel like you've got your cycle optimized. And that's when the chances for fertility are the highest. Lastly, what if I forget to take it? You're fine. You'll be okay. I don't think you won't have like withdrawal effects or anything like that. But you're best if you can kind of do it on this particular schedule. So in general, what you want to do is, whether you're working with your practitioner or you're sort of doing this on your own, is do things in such a way that you can really sort of track whether they're working or not. So if you sort of haphazardly take your herbs, then it's hard to know if you're really getting some benefit from it or not. But if you do kind of do it in this more structured way, kind of right when your period ends, and then right kind of leading up to ovulation in the middle of the cycle, and then you do that for a few cycles, then you'll have a good feel for whether you're getting the benefits from these herbs, or if you're or if you need something else, or what have you. But if you do it sort of more haphazardly, then you just won't know if you won't know what's sort of the most important thing here. You won't know if you've gotten benefits from the herbs or if they really aren't helpful. So those would be some of my tips. That's sort of all I have for sort of kind of the basics here today, but I'd love to hear from you and answer any questions. If there's any folks with questions, I'd be more than happy to do my best.
Yeah, and I can moderate here too. So if anyone has any questions, feel free to chat them over to us. But Eric, one thing that you mentioned was if for women who aren't having a period, the women's kit is helpful for kind of maybe trying to get your cycle back. Can you talk a little bit about how you would take those formulas if you weren't having a period at all?
Yeah, and it might depend on why you're not having a period. So So I can imagine a couple of different situations. If you and you know, there's again a lot of complexities here. But for example, if you had been on the pill for a significant amount of time, women sometimes have trouble coming off the pill. Um, and if it's still several months and you haven't had a period, you could sort of imitate a little cycle yourself. You could do sort of just as we said. You could do the women's kit for 4 or 5 days, and then followed by emotional balance. Women's formula 4 or 5 days, and then emotional balance for 4 or 5 days, and then sort of give yourself 2 weeks, see what happens, see if you notice something, and if you don't, maybe try it again, and try to through the herbs, sort of see if you can sort of simulate some of the shifts that have to happen during the menstrual cycle. So that could be one technique. If you haven't ovulated, and maybe it's and perhaps it's due to something like polycystic ovarian syndrome. It's a more complicated problem, and these formulas may not be the best fit, and that's sometimes when you have some of those more complicated diagnoses, then you want to work with a local practitioner. So it can kind of depend on the situation, but particularly if you're somebody who used to have a normal cycle and for some reason you don't now, this would be one way to kind of think about possibly jump-starting it.
And can you talk about some acupuncture points or ways that you like to pair acupuncture with some of these herbs?
Yeah. So let's see. Well, if you, I think again, kind of depending on what's going on. Typically, I definitely like to do a few points that I like to do. Might be some abdominal points. I'm a big fan of, and I'm bad with numbers, so let's see if I can look up the numbers for you. I won't be able to, but I know that Jenny's names. But the points that you might really want to check out on the abdomen and palpate for are the points on the kidney meridian. So those are points that I think I ignored for a long time. But if you were to examine them on a patient with some fertility issues or other gynecological issues, you'll often notice some real sensitivity there. So these are the points that are sort of like a half ton away from the conception meridian. And Zhongju is one I like. That's kind of just one ton down from the navel. But palpate some of those points and see what's going on. Sometimes I'll also pair those with maybe like Guan Yuan, which is on the conception meridian, 3 inches down, or Qi Hai, which is 1.5 inches down from the navel. Those can be like a little set of kind of abdominal points, or something like Gui Lai. Now that's going to be 3 inches out, kind of closer to like where the ovaries themselves just sit abdominally. So those are some interesting abdominal points. And then for the extremities, I would look at, you might need to look at points like Tai Chong, which is I think that's L3. I believe that's right, the third point, the liver point. Zu Sanli, those are all kind of classic points. So yeah, look for and you've got a number of choices, I think, on for your extremities, and I think that this depends a little bit more about what's going on. I guess my little secret tip would be to go back to that kidney meridian on the abdomen, and I found a lot of very useful kinds of points to work with there.
And then I know we're kind of running out of time, but I just have one quick follow-up question to that. When you are seeing patients to help them get pregnant, how often, how many times a month, or how often do you recommend them coming to see you for acupuncture?
Yeah, good question. I try to have them come once. I try to have them come once a week. Particularly if we're doing acupuncture. I think you don't want to do it less than that. And in
Sure.
China, people would come more than that. They might come several times a week, but it's hard in the U.S. I think to get your patients to come that much just because of cost issues.
Yeah.
But I think then also pairing your acupuncture treatments with like some herbal medicine can be really useful. And then I think one of the challenges is just to get your patients to stick with it and come back, and that can be hard in gynecology. You have to kind of explain to them like, we have to like think in terms of months here. Like we have to really see because there's often not much to kind of follow in between the cycles, and so and you will often have like positive things happen, but that doesn't but that doesn't necessarily translate into conception immediately. So it just requires some patience. And but I would try to get people to come once a week if you can.
Okay. Cool. Yeah. Okay. Well, thank you everyone for tuning in, and thank you, Eric, for sharing your expertise with us.
My pleasure. And I'll look forward to talking with everyone next time.